If arthritis makes your hand feel stiff, achy and weak, I want you to try something with me. We're going to see if it works in just 30 seconds. But before we do, let's test your hand. Try these simple functional tests. Make a fist, open and close your hand, and then try something which is normally painful or difficult to do, like opening and closing a jar. With those, make a note of any pain that you feel, what the range of motion in your hand was like, and what the strength was like during that task. So we can retest those after I've shown you the first technique. Now later in the video, I'm going to show you some strengthening exercises which are really helpful if you have osteoarthritis in your hand, and I'll also show you some ways of using your hands differently that many people often don't realise or overlook, which can make a significant difference. I'll also be testing out this hand massager product. These seem to be popping up online all over the place as soon as you type in hand pain. So we'll have a look at this and have a trial and let you know what I think. During this video, I'll also be using some other simple, inexpensive products to help reduce hand pain and improve strength. Let's get started with the first technique. It's a simple self-massage technique. Using the thumb on your opposite hand, begin by running down over the muscle on the little finger side of your palm. Just press with a firm but comfortable pressure and make sure you don't cause any unnecessary pain or put any unnecessary strain through your thumb. If you're struggling to use your thumb on your opposite hand, then don't worry, I'll show you some other tactics should that be the case. So move through the hand, running over these bones in the palm. These are your metacarpals. Run through the hand and then try and target the spaces in between the hand bones. I'll put a picture on the screen here. So run down in between those bones. And if you're wondering whether I've used any wax or cream on my hand, yes, I have. You might not need to, but if you're struggling to massage because the skin is too dry, then go ahead and use some form of emollient over the hand. If you don't have any massage lotion or wax, moisturizer is perfect, or perhaps even some cooking oil if you're desperate to get started. You see around the thumb here, there's often a pad of muscle, so go ahead and work into that area as well. Do 2 or 3 repetitions through each area. If you find a particular area which is sore or tender, then you can focus on that a bit more and do a couple of extra run-throughs over that area. Okay, so that should get you started. Do that for 30 seconds and then return back to the tests, which were the fist, the opening and closing, and that functional grip strength. So we were gripping the jam jar in this case, which may be a bit more difficult if you've got wax or cream on your hands, but hopefully you can feel that your grip strength has improved, or you're able to grip a bit firmer with less pain following a quick bit of massage through those hand muscles. So I hope that simple technique was a good start. Now I've got lots of other helpful things to show you in this video, and I'll also explain why I've got this large piece of cutlery. It's actually very useful, and we're not going to use the fork end, we're going to use this end here. But before we move on, a quick bit of information about osteoarthritis. Osteoarthritis of the hand is actually very common as we get older. In one large study of adults over 70, symptomatic hand osteoarthritis affected approximately 13% of men and 26% of women. And importantly, hand osteoarthritis is not simply a problem of having worn out hands. The symptoms can fluctuate considerably. There may be periods of time when your hands are comfortable and not giving you any pain, and then other periods of time where your hands become painful, stiff and more difficult to use. It doesn't mean that the osteoarthritis has necessarily changed, but having that natural fluctuation is one of the features of the condition. So if you have any doubt, please make sure you see a medical professional. So if you were struggling to do the self-massage because of pain or stiffness in your opposite thumb, then you can get a massage tool. Now you should hopefully be able to find something in your kitchen, in your cutlery drawer. We're not going to use this end, of course. We're going to use this end, which is large, smooth and beveled, so that can become my surrogate thumb. So instead of using my thumb and straining that, I can hold this and then use that to perform the massage technique. And it is actually surprisingly comfortable. You just need to make sure that you don't push too hard. But as long as what you're using has a smooth edge, it should glide nicely over the skin. Remember to use some wax or emollient if you need to. You may not need to. So I'm tracking down in between those metacarpal bones. Remember those, we pop those up on the screen. Now you can get some more purposefully made massage tools. I've got a self-massager here from the brand Trigger Point. It's got the ball that rolls in there, so I can hold that and then use the ball to roll over my hand, and that actually feels quite nice. It's a little bit less intensive than using the piece of cutlery. The next technique teaches you how to be your own chiropractor for your hand. So we're going to take those metacarpal bones in the hand that we're familiar with because we've been massaging around them. We're going to take the opposite hand and use a pinch grip like this to grip both the underside and the back side. We're going to start with the little finger one, the pinky side, and we're going to hold there with a firm grip and then mobilize that forward and back, okay, so towards the palm and then away from the palm. So the bone there is being gently glided up and down, and you'll feel a little bit of movement, or what we call a bit of joint play, but you will need to relax your hand, so make sure you're not tensing the muscles in your hand. Do that for up to 30 seconds, usually around 10 seconds is enough, and then move on to the next metacarpal underneath the ring finger. But you can do the same thing, so a close up on the camera there, you can see that I'm mobilizing that metacarpal up and down, and there's a little bit of movement visible as the knuckle is rising up and down. So again, up to 30 seconds, 10 seconds is probably enough. If it feels good, keep going for a bit longer. Then move across to the next metacarpal, that's under the middle finger. That one does feel a bit stiffer, doesn't want to move as much, but it still moves, it just needs a little bit more persuasion. And then we're over to the index finger side. If you can't stretch across, then come around from this side and once again mobilize up and down. So that's a nice, safe self-mobilization technique for your hand. I hope it helps. Let me know in the comments. After doing those mobilizations, you can do those simple tests that we did earlier and see if, nope, I still can't open the jam jar, so we'll keep going. Now, before we move on to the important hand strengthening exercises, let's do a quick review of the hand massage device. So to be clear, I'm not promoting this device. I have not been paid to promote it. I'll put a general Amazon affiliate link in the description and possibly on the screen here, which will take you to a page selling devices like this, possibly including this one. So I'm not promoting any specific product. But if you do have a look, you'll notice that they all look much the same, but with different price points. They usually come as a single item and they will work for both hands. You just have to turn it over. So I use it for my left hand because then we can see the control panel on the top. So my hand is, I don't know, probably larger than average perhaps, and it fits in there quite nicely. It's quite snug. There's a glove inside. So I go ahead and switch the device on, and straight away you can hear the pump noise. It is inflating the glove inside the device, and it is squeezing my hand and fingers. It's got a separate cuff around the lower hand, possibly upper wrist, depending how far you're able to put your hand into the device. And the pressure is building and then reducing as it's inflating and deflating. And I'm getting some temporary hand squeezing, which is novel. I wouldn't necessarily say it's that therapeutic. Sometimes it feels like it's squeezing the hand a bit too much as it's starting to reduce the blood supply through to the fingers. But then when it releases, it feels quite nice because you get that rush of blood going through to the ends of your fingers. If you have a look at the Amazon reviews for these and this product and similar products, which I would encourage you to do, reports are generally positive. Lots of people mention about the heat function, which I haven't yet activated, so I'll go ahead and press this button here. If I press it 3 times, that lights up as red and indicates that it's going to heat up more, it's more intensive. So don't all rush out and buy one, but do have a look and give it some consideration if you're looking for something to help reduce your ongoing hand pain. So now we're going to look at a few simple and novel strengthening solutions. To warm up your hand or hands, do this simple exercise. Open the hand as far as you can, splay the fingers, and then close the fingers and close the hand. Get that going with a simple rhythm and perform 10 to 15 repetitions just to get your hand warmed up and moving as much as possible. First, we're going to look at some gripping exercises. Take a ball, perhaps a tennis ball will do. I know this is not a tennis ball, but it's a similar size. Form a grip around that and then grip with a moderate intensity, firmer if you can, for 6 seconds. Then release, open the hands, splay the fingers and repeat that 6 times. So you can begin with 6 seconds, rest and repeat 6 times. If you find that easy enough, then you can grip a bit harder or grip for a bit longer. You may have some other options, such as a ball which is a bit smaller or a bit squashier. This is a squashy ball, so that's a bit more comfortable to squeeze. So that one's quite nice to use. And these inexpensive grip strengtheners can also be found online. I'll put a link in the description. This one is from a brand called Skills, which is recommended, but you'll see other similar ones at different price points. The thing I like about this one is it is adjustable, so you can make it harder or easier. You can hold it for 6 seconds, but you don't necessarily need to do that. Instead, you can squeeze and release. Now, hand therapists usually recommend therapy putty because it allows you to be more dexterous and use your individual fingers and thumbs to manipulate the putty in your hand. So it's a bit better for specific finger strength and coordination. Perhaps you need to work on your key grip, for example. You can use the putty there to squeeze into the key grip and work on strengthening that action. Or maybe a particular finger is sore, and as well as massaging and mobilizing it like we did earlier, you may find that strengthening a particular finger into flexion helps to reduce the pain over a number of strengthening sessions. So therapy putty, again, I'll put a link in the description. It's not expensive, and if you're wondering, this one here is medium density, and you can see the brand that's written on the top. And it's normally recommended to do the putty exercises once a day or every other day for around 2 to 3 minutes. Now, there is a hand exercise that most people don't know and don't do. A lot of hand exercises are like the ones I've just shown you, where you are gripping and closing your hand. That works certain muscles. But people rarely exercise the opening muscles that open the hand and splay the fingers. And doing so can really help make your grip stronger and possibly reduce your hand pain. So to get started, see if you can find yourself an elastic band. Hopefully you had one come through the post recently, or there's one in your office drawer. Put that around your fingers and then open and close your hand like this. So your fingers are closed, and then open up like you're making a spider character. Close, and open. And that is the exercise. You're probably wondering how many to do. Well, we could say 10 to 15, but it does depend on how much resistance there is and how strong your hand is. So I would say do these exercises until you feel a slight ache in the muscles in your hand. That indicates they're getting tired and fatigued. At that point, stop, have a rest, perhaps do the other hand, performing 2 to 3 sets of the exercise. Don't do too much to start with, otherwise you'll probably end up with a very sore hand, as those muscles are not used to being worked in such an isolated and concentrated way. Now, if you jump online, I'll put a link in the description, you can get some inexpensive specific bands for strengthening your hand, and they can be one step better than the elastic bands. They often come in a pack of different colours and resistances, but that's a good way of upping your game and improving the strength. Spend a little bit more, not much more, a little bit more, and you get a purposefully made band like this with the finger loops. So these are actually really good. So you go ahead and pop your thumb and fingers in, a little bit more fiddly, but ultimately more comfortable because they are gripped onto your fingers, and then you can focus on that opening exercise a bit more. So this is the best option. I'll put a link in the description, but the other ones are also quick and easy to do and ultimately achieve the same thing. So they are your secret hand opening exercise. Go ahead, give them a go, and hopefully after a few weeks of doing these on a regular basis, you should notice some improvements in your hand function and strength. Moving on to the next piece of advice, and that is how you use your hand. One of the most common things that I see when I'm working with people with hand pain is that they are gripping things too tight for long periods of time. So if they are crocheting or knitting, for example, then they're often gripping the knitting needles with too much intensity. This causes hand fatigue and of course the build-up of pain and discomfort. So even if they stop what they're doing and they do some hand stretching, mobilisation exercises like we've gone through, if they return back to the death grip again when they're using tools, then that can be a cause of hand pain. And the same applies to activities like gardening or sports like golf as well. If you or they are gripping the tools or the equipment too tight, then that can be the cause of these symptoms or definitely an aggravating factor. So loosen your grip. The next thing is to look for devices which can make things more comfortable and easier. So if we look at knitting or crocheting, for example, you can get specific ergonomic crochet needles which allow you to grip a little easier because the handles are larger. And as for the jam jar, hopefully after you've been doing the strengthening exercises for 2 to 3 weeks, you should be able to notice an increase in strength and an increase in function. But if you're still struggling to open the jam jar, there are devices and ergonomic things that you can get to help you. I'll put some options on the screen here and a link in the description. Sometimes for hand pain, I find cupping helpful. I'm using a silicone cup here. It's a Rock Pod from the Rock Tape brand. And once that's on there, you can use that as a simple massage tool to mobilize the soft tissue and muscles in the hand. And then next up, we have these arthritis gloves. Now you can buy these from many different brands. They are considered to be effective, so I would recommend grabbing a pair, particularly if you live and work in a colder part of the world, like the UK in the winter, for example, not so much in the summer. But these provide a light level of compression. They are comfortable and thin, and the reason the fingertips are free is so that you've still got your sensitivity and dexterity to perform indoor tasks such as writing and operating your phone, for example. But these are surprisingly helpful and effective for the price. They usually come in at less than £10, which is fantastic. So have a look, I'll put a link in the description. I would recommend getting a pair of these, especially if you are in a cold climate. Give these things a go for 2 to 3 weeks and make sure you see a medical professional if you have any concerns. This is an educational video, not medical advice, but I hope it helps. My name is Daniel Lawrence. You've been watching the Physio channel. Thank you for watching. Let me know how you get on in the comments, and we'll see you in the next video.